Good afternoon, everyone. We are going to go ahead and get started. Welcome to our webinar on cold weather and disaster response. This is part 2 in the National Healthcare for the Homeless Council's webinar series on Winter is Coming. I'm Regina Reed. I am the policy manager at the council, and I will be moderating the panel today. Our communities are continuing to deal with the impact of COVID-19, and the upcoming winter season presents additional challenges, especially to organizations providing care to people experiencing homelessness. That's exactly what this series that we've dubbed Winter is Coming, which is a Game of Thrones reference for anyone who isn't familiar. That's exactly what Winter is Coming is. It's a framework for the challenges that we're going to face in the coming month. You can see the 6 challenges outlined here on this slide: coronavirus, flu season, cold weather, national disasters, eviction wave, and social upheaval. Last Friday, we had part 1 on coronavirus and flu season. Today, we're talking about cold weather, natural disasters. And next Friday, we will have another webinar on eviction wave and social upheaval. I will put links in the chat where you can find the archive of webinars that have already happened and register for the webinar coming up in a week from today. Even if you can't make it, please register so that we can get you the recording over email. Before we jump in, a few housekeeping items. How today is going to work. We will first hear from our presenters, our 4 panelists, and then we will have time, hopefully about 10 to 15 minutes at the end, for open discussion and Q&A. I invite all of you attending here on this Zoom webinar to chat with us, engage with us. Please start by introducing yourself in the chat box. We want to know who you are, where you're from, what you do. And then throughout, please respond, react, put questions and challenges you're facing into the chat box. We want to hear about that, and we want this to be an open forum. We will also have an evaluation survey that will be shared at the end of the webinar. Please do that. That's really helpful. I want to acknowledge that here at the council, we value diversity, and we do our best to highlight perspectives from different geographies, professions, the lived experience of homelessness, and racial and ethnic backgrounds. So I invite you, especially when you fill out that evaluation form, to provide suggestions on how we can be recruiting diverse panelists, especially as we're putting more and more materials and panels and webinars together on these topics in the coming weeks. I'm so excited to have a great panel lined up. They are the experts and they have so much to share. I can't possibly do their backgrounds and their bios justice, so I'm not even going to try. When they speak, they will introduce themselves and tell you more about what they do. We will start with Noah, who will do a national overview of disaster response, John, more of a national overview of cold weather, and then Mike will touch on what he's doing at the state level to respond to both of these issues, and Jody will go into what they're doing at the local programmatic level, and we will discuss from there. So this is your other reminder for my attendees. Please chat with us, engage, put questions in. There's a chat box you can put them in, and also a Q&A section. If you see at the bottom of your screen, it says Q&A. If you click on that, you can put questions in there too. So that's my reminder to attendees. And this is my stern but friendly look and reminder to my panelists that I'm asking them to stick to 10 minutes each. So that's my reminder for my panelists. And with that, I will stop sharing my screen and I will pass it over to Noah to get us started.
Great. Thanks, Regina. Yeah, Noah Patton. I'm a housing policy analyst at the National Low Income Housing Coalition, NLIHC, and I coordinate our Disaster Housing Recovery Coalition, which is a group of over 850 state, local, and national groups all working at that intersection between housing and disaster recovery. We started that coalition after Hurricane Harvey in Houston, kind of when we noticed that there wasn't any real coalition building going on in that space, and that often, disparate disaster areas were having disparate responses, and folks weren't kind of taking a broader view to try and connect best practices and recognize programmatic issues and things like that. So we've been hard at work on that. In terms of COVID, I think we, pretty much doubled our membership and interest in that coalition. And after I am done prattling on about disaster recovery, I'll throw a link in the chat box for you to see what kind of working groups we have and kind of get involved in our conversations. That's provides a great place to connect with other folks that are doing disaster recovery work, that may have already dealt with the challenges that you're facing, may have good advice and best practices, and at least let you recognize when an issue is local and when it is federal or countrywide. And yeah, Noah Patton, here in Baltimore, I've been working for NLIHC for 2 years, a graduate of the University of Baltimore School of Law. So we're here to talk about disaster recovery and cold weather. But before I talk specifically about disaster recovery and homelessness in specifics, I wanted to talk about some larger concepts and kind of give a broader overview before we get down closer to the nitty grittier of it. So in emergency management, a disaster is different from a hazard. So a hazard is like a threat, like a tornado, like a hurricane, a polar vortex, a wildfire, what have you. And a disaster is what occurs when a hazard overwhelms a community's ability to respond. And that causes a breakdown in essential services, dangers to human lives, and damage to property. So using this, and actually, no, I did not do any slides. I'm just shooting from the hip here, although I appreciate the interest. So using that definition of disaster, you can kind of include things such as heat waves and cold snaps into that definition, as well as pandemics. So one of the most notable examples of that being like the Chicago heat wave of 1995 that led to 739 heat-related deaths over a period of 5 days. And that was something that has since not been recognized as a disaster by the city of Chicago, but that would fit into our definition of what a disaster is. Next, I'd say I think it's important to say this up front when it comes to disaster recovery. Low-income households and individuals and families experiencing homelessness often experience the biggest impacts of disasters, but receive the least assistance to recover afterward. More disasters are happening. They are being more intense, and they are hitting areas that are not used to seeing such disasters, which makes it all the more important that we have conversations like these ahead of time and come up with plans and advocate for our clients to make sure that they're able to withstand that disaster. Next up, I think it's important to note the reason why these disasters are happening more frequently, and that's because of climate change. It's important not to view our prep for disasters as something outside of that whole climate conversation, but it needs to be acknowledged that when we make plans for disasters, we are preparing to try and mitigate the effects of climate change, and that working to address climate change is also disaster recovery work. Something that I think as housers, we often, don't really acknowledge or think that it's in our lane, but I think kind of integrating that idea into our disaster recovery mindset can lead to some interesting collaborations with climate action and environmental organizations and so on and so forth. So I think that's an important facet of this conversation. Next, as a result of these more frequent disasters, FEMA is being stretched very thin and is more and more hunkering down on that phrase of federally funded, state coordinated, and locally executed as their core philosophy. Now, FEMA and emergency management as a discipline typically make disaster recovery plans centered around their idea of a typical disaster survivor, which is oftentimes a white male that owns his home and has decent insurance to cover it. So this leaves very little room for folks not matching that definition, which means that they are often, addressed only tertiarily in a disaster recovery plan. There are no real efforts being made to reach out to historically vulnerable or historically marginalized populations, which is important for, to know as folks in this field that, that more advocacy is most certainly necessary. I'd also say that FEMA is incredibly protocol driven. They will follow their memos to the letter, regardless of external issues and unique circumstances of a certain disaster. They are crazily worried about waste, fraud, and abuse, over eligibility, over trying to cast a wide net to ensure that all households affected by a disaster are able to recover. So it's really important to keep in mind that you're very, very few times are you going to be able to have FEMA employ the flexibility needed to adequately cover a lot of these low-income households and individuals and families experiencing homelessness. And so that just makes, again, like outreach to local and state emergency management agencies that much more important, because not only is FEMA not ensuring that, best practices when it comes to working with folks experiencing homelessness are trickling down to the local level. They're really just providing grant money and allowing states to kind of control or organize their own response and allowing local officials to execute it. So it's important to keep that in mind as we talk about this subject. Finally, I'd say that it's important to make a distinction here between folks experiencing homelessness before the disaster and after the disaster. When I say pre-disaster folks experiencing homelessness, I mean that they were experiencing homelessness when the disaster struck, not afterwards. While it'd take me probably another, probably the rest of the day to explain all the issues that low-income households experience trying to access FEMA assistance after a disaster if they've lost their home. I think today we're talking about those folks experiencing homelessness before the disaster and what we can do to assist them. So it's also important to note that the failings of disaster recovery assistance programs does directly correlate to the amount of folks experiencing homelessness after a disaster. A substantial portion of Harris County's PIT count respondents in 2018, the year after Hurricane Harvey, did indicate that they became homeless as a direct result of Hurricane Harvey. But again, we're talking about pre-disaster homeless individuals. Kind of moving on from those kind of like top line, I guess, ideas or concepts, I wanted to talk about disaster recovery in terms of 4 phases. So there's the emergency response, there's short-term recovery, there's long-term recovery and mitigation. And these phases are circular. So mitigation needs to happen after a disaster as well as immediately before a disaster begins. So there's that constant cycle of disaster recovery happening. and making sure that you are discussing mitigation even before a particular hazard is identified is of crucial importance. In terms of emergency response, folks experiencing homelessness before a disaster are often excluded or face additional barriers to accessing emergency shelters. During Hurricane Michael, folks experiencing homelessness were not taken to general shelters. They were placed in specific shelters that were separate from the general evacuation shelters. Following Hurricane Irma, advocates reported that folks experiencing homelessness were forced to wear armbands and kept separate from other disaster survivors. So these actions not only further stigmatize people experiencing homelessness, but they often bar them from the resources they need to stay safe during a disaster. There's also the fact that police play a large role in evacuation and emergency sheltering. In some states, the entire state emergency management department is directly run out of the state police department. And that means that police are very visible when it comes to evacuation programs. They're very visible at the shelters, which can often be a significant deterrent to folks experiencing homelessness trying to reach out and interact with the emergency response system. Additionally, for folks with disabilities, it can be even harder to find acceptable shelters. It is still an ongoing issue that some shelters in some areas are not ADA accessible, and that those folks need to travel a significant distance in order to access a safe, accessible shelter, which creates its own issues, and folks living with disabilities are 1 to 2 times more likely to perish during a disaster than those that aren't living with disabilities. And so that's a significant issue. And credit where credit is due. FEMA has been working hard to ensure that local grantees and state governments are ensuring that their programs are ADA accessible, but that's still an upward battle in many parts of the country. There's also things like emergency notifications, evacuation orders. How do those orders get to folks experiencing homelessness? How do you give those folks a heads up that there is a hazard coming, that there will be a real possibility of needing to evacuate? There's also, issues with language. If folks have a low English proficiency, they may not be able to understand the emergency notifications, even if they do get it. And oftentimes this issue will play into it's the same as much larger issues that affect how low income households are able to weather a disaster. But I think a lot of times it's magnified by, our clients' homelessness and made all the more difficult to surmount. Moving on just to short-term response, which is kind of like, all right, everybody's in the shelter, like, what do we do now? That phase of disaster recovery. FEMA views its role as a disaster recovery agency as restoring the community to how it was before the disaster struck. And as a direct correlation to that, FEMA does not effectively include folks experiencing homelessness in its plans or programs. I'll talk about it in a second, but there's very little in the way of assistance provided through FEMA to individuals experiencing homelessness after a disaster. And advocacy efforts with the agency have really been unfruitful. I think that's a whole attitude at that agency that their responsibility is solely returning things to as it was prior to a disaster, and anything more than that is a misuse of federal government money, which I would say, and we would say at the DHRC and NLIHC, that that's completely the wrong way to view it, and that a disaster does present the opportunity to correct a lot of structural issues in communities in terms of inequality, in terms of housing that had been created by, decades of Jim Crowism, of white supremacy philosophy and things like that, that, if we just spent all that money trying to get our community back to the unequal way it was before, like, was that money really all that well spent? And I think that's kind of the attitude that we're attempting to kind of imbue when we talk about emergency management reform. So as I was saying, FEMA does not provide housing assistance to homeless applicants because the need for housing was not caused by the disaster. I'm reading directly from the FEMA policy here. Homeless applicants must verify their pre-disaster living arrangements through a credible or official source at the time of inspection or by submitting documentation demonstrating the applicant lived at a location pre-disaster, such as a signed written statement. See what I'm talking about? They're very protocol driven, and there is a smidge of assistance available to folks experiencing homelessness, and mostly that comes in the need of some form of other needs assistance, which is like transportation help, medical expenses, dental, funeral care, child care, and such. Now, crazily, FEMA does make a distinction between folks it deems homeless and folks it deems residents of non-traditional housing. Now, that includes folks that live in tents. So if the individual's occupancy in a tent can be verified, then they would be eligible for certain initial rental assistance, which is like a reimbursement for rent, which is really not that helpful for the population that we're talking about, as well as an expanded other needs assistance. And it's, I've worked in homeless services in Baltimore before. I've never seen the distinction made between someone experiencing homelessness that didn't live in a tent or that did live in a tent. And it's completely arbitrary. And it's kind of based on this idea that, oh, if somebody was living in a tent, that's kind of like a house, so then they would be eligible. But if you can't prove that, then they get basically no assistance. And so that's kind of like what we're up against, at least at the federal level, in terms of advocacy when talking with FEMA as an agency about taking care of folks experiencing homelessness. Now, after I've what?
Final thoughts?
Oh, yeah. So I guess, still by and large, homeless populations are denied FEMA assistance outright. That is horrible. And I guess I would just say that it's just so important that since FEMA is not coming, the federal cavalry is not coming, we need to be talking with our local governments. We need to be talking with our state emergency managers. We need to be talking with our local emergency managers to ensure that all of their recovery plans include individuals experiencing homelessness, that they have a plan for encampments, they have a plan to identify those encampments and just include them in a greater way in those local response plans, because that will provide us with a greater footing when the disaster finally ends to begin rebuilding equitably. Boom. See, I said I could just rant about this all day.
Great. I fantastic final thoughts there. I will just swing it on over to John.
Great. Thank you, Noah and Regina. So hi, everybody. I'm John Gilvar, Gilvar Consulting. So I provide coaching and consultation to organizations working toward equity and justice at the intersection of health and housing. I worked for almost 20 years for Healthcare for the Homeless programs and collaborated with emergency management, public health staff, et cetera, on disaster responses like to hurricanes, and also in Seattle on the hepatitis A outbreak. I currently am on a team of HUD technical assistance providers that is working. There's a disaster response group, but it's a lot of our work right now is around winter is coming, the topic of this series that the council has put on. So I really appreciate being invited today. And I'm going to try to really briefly, oops, I need to share my screen. Going to share my slides here. Oh, I should be able to find them. Not sure why I'm not finding my. Okay, let me just see if this works. Can you see my slides?
Yep, we see
Okay,
them.
great. Okay, so I'm going to just very briefly run through some of the tools that HUD technical assistance providers and groups like ours that I'm part of are guidance and tools support for communities that are facing really difficult choices as winter approaches. And we've been talking to communities all around the country, and we're really aware that there's these three critical questions that are up on the screen right now. So how can we both maintain pre-winter shelter decompression levels to mitigate COVID-19's outbreak risk? So reduction in the number of beds, the number of people, efforts to allow for social distancing and so forth has meant that the traditional emergency shelters are serving a lot fewer people, if that makes sense. And at the same time, how do we, while we're maintaining those shelter decompression levels, how do we prevent weather-related death and severe illness? So, we know that we'll save lives from bringing people in from out of the cold, but if we do this in a way where our infection control abilities and prevention abilities are compromised, then we can increase the risk of COVID outbreaks, which we've seen in many communities around the country in shelter environments. So it's a difficult situation for many communities. Another critical question: how can we assure that COVID-19 prevention protocols are integral to any new sites or programs? So if a community, for example, near where I am in Seattle and King County, a new shelter was just stood up. Well, in those situations, there needs to be intentional effort and collaboration to make sure that the prevention protocols that were put in place in King County's traditional or existing congregate shelters are put in place at the new ones. And I know for a fact that that's happening, but that's not always easy. And then the third question is, how can COCs and other HUD homeless services grantees maximize engagement of critical community partners in conducting contingency planning that addresses those two questions? And examples of the kind of partners that have been very, very helpful to different communities are healthcare for the homeless programs, public health departments, and emergency management entities. So I'll go to the next slide. Great, so I'm not going to go into these in detail, but I'm just letting you know these are, when these slides go out, these will be hyperlinked. So there's a general winter planning guide that's a kind of comprehensive guide with a lot of great tools, that you can just, they're sort of ready to use, that you can just download and use to, for example, when you sit down with if you were, say, from a COC, you're sitting down with your partners from healthcare for the homeless, public health, emergency management, you could use these tools to frame the entire conversation, right? So you don't have to waste a lot of time making everything up from scratch. These are tools that are designed to sort of fast track the work that needs to be done. And there's, I won't go through all these, but there's a whole suite of products. I would mention a couple things. There's a couple products that aren't listed here, but be on the lookout for them. There's one that's promising approaches to adapt. I'm not giving the exact title, but it covers promising approaches to adapting testing strategies during the winter. So that will be very, I think, interesting and useful for healthcare for the homeless grantees and their partners. The two communities that are mostly highlighted there are Boston and Boston's HCH program, as well as Seattle Public Health. where we'll hear from Jody, a speaker that's coming up soon today. But there's both the interesting ways of adapting testing models in the winter. Then there's also an infographic that's coming out that's aimed more at sort of the broad community work, where the idea is to prevent shelters from getting a situation where they have to choose between, if someone shows up at the front door on a very cold night, they have to choose between letting them in and safe and keeping them safe and sort of compromising their decompression levels and their social distancing. To avoid that, there's a whole menu of strategies. So they run from supporting alternative sites like non-congregate shelters to adapting existing diversion and problem solving strategies. So I won't go into detail on those either, but maybe if there are questions about any of that during the Q&A, I'd be happy to address some of those specifics. So just a point that we feel like it's really always critical to put out there, that when we're doing these community collaborations with the types of partners that I just mentioned, it's really, really important to make sure that the folks at the table are representative of the racial makeup of the population served by the homeless system, and that those tables include people with lived expertise of homelessness. I can't say enough about how critical that is. And I know that from personal experience, that there's work involved, there's outreach, and there's logistical work that's involved. And we may feel like, oh, it's an emergency, we don't have time to do that. And that would be a huge mistake, because these folks are the ones who are going to be the most helpful in making sure the focus is in the right place with these decisions that need to be made. These are, I won't, for the sake of time, I won't go through all of these, but you'll see in the slides the different partners and the different roles that they have in planning. You'll see healthcare for the homeless is prominently featured, behavioral health providers, again, people with lived expertise. I'm not going to go into this in detail, but this is just a slide that talks about contingency planning, where it's assuming that the community will be able to do a baseline projected need for shelter beds based on data from prior years in the winter, how many additional beds were needed during the winter. And then there's a plan for surges in demand. So, what would happen if demand goes up, say 10% to 20%? That would be considered maybe a marginal surge. And then what new partners and what new resources need to be brought to the table to deal with that marginal surge. And then a substantial surge, there's no specific definition, but just say over 20% of an increase in demand over your projections. Then you really maybe need to pull out all the stops in terms of getting making sure that your partners in the emergency management world and the public health preparedness world and public health response world are really focused with you on increasing the capacity of the system, your entire health homeless services system, to shelter a substantially higher number of people. This is just a spreadsheet that's part of those tools that helps you do exactly that. These are some of the factors that are considered by these tools. New facilities, how are you going to staff new facilities and new programs, transportation strategies, and how to keep people safe when they're in transit. Just for the sake of time, I'm just running through these really fast. We could come back during Q&A if needed. And then there's sort of again, making sure that any kind of new shelter or any kind of new site that's stood up, and existing sites for that matter, are following guidelines, and there's training of staff around physical distancing, mask wearing, enhanced cleaning and disinfection. That just needs to be a baseline across the whole system, and not compromised when new facilities are brought up to speed, which is a serious challenge, frankly. If in past winters you had pop-up shelters in basements of the city hall or churches, et cetera, and there were a lot of volunteers that were brought in to manage those, it's going to be an undertaking to make sure that those folks that traditionally stand up and manage those sort of temporary cold weather shelters are completely up to speed, and that you don't end up with an outbreak because of people weren't wearing masks, or there really wasn't enough attention to disinfection and social distancing, et cetera. So that's just a really important factor there. They're part of the winter planning guide that I talked about, that you'll have a link to when you get the slides, is a checklist, so that you can actually, again, you can just pull it out of the product. You don't have to make it up on your own, and you could hand it to, say, an entity that's standing up a new shelter. Say it was at the library or the parks department, and the city staff were standing it up. You could just hand them a checklist to make sure that all these points were covered. So I'm going to stop there. I'm looking forward to some good Q&A, and again, thanks for having me today.
Thank you, John. And you can
Stop sharing.
stop share button. Really a wealth of information that we can't get to all of it in this time. I will pass it straight to Mike.
Yeah, thanks, Regina. Just really appreciate been reflecting on one of the comments in the chat here from Rosemary. Really just trying to point out the needed focus on like the humanity of the folks that we're talking about, and you know, diving into the details of these programs and the ins and outs of like how we respond. It is definitely the work that we need to do. And just, I mean, this week we saw one of the first deaths from exposure. A 57-year-old homeless man died in Oregon this week due to exposure from cold weather. And you know, I just want to honor that life and those lives that are going to be lost because of our policy decisions, our structural racism, our inability to respond adequately to the need and really see people that are like valuable, see like people experiencing homelessness as like having inherent worth. Like those are decisions we make as a society and as policymakers that like we're left with that. So I appreciate the thoughts on that, and hopefully we can dive more into that in the Q&A. But hey everyone, Mike Savara. I am the Assistant Director of Homeless Services with Oregon Housing and Community Services. So my background, I'm a social worker and an addiction counselor. I used to work with a healthcare for the homeless agency doing direct services in behavioral health, outreach, and worked in a shelter and a medical respite for a good while. So I just want to dive in from the state perspective and really try to provide some kind of frames for how we've thought about some of the needed response from COVID around the cold weathers, as well as the recent wildfires. Many of you may know that we had a series of devastating wildfires in early September. The wildfires we have 9 confirmed fatalities from the wildfire impact. 1.2 million acres burned, and over 4,000 residences were destroyed. So the response from that, it's a federally declared disaster, and we have FEMA on the ground to support us in our response. Several of our counties have housing missions to really drive home the need for additional assistance. The impact of that wildfire disaster heading into winter, combined with the lack of available space that we have because of COVID, because of what John was hinting at around the social distancing shelters, really made us re-examine and rethink how we do our work at the state level. So I just want to kind of bullet point a few things that we've really had to do some soul searching on and really think through. How are we responding in a way that's adequate or responsive to the situation at hand? So I think the first thing I want to just hit on is, also there's no slides. I didn't prepare any slides today, so I'm shooting from the hip like Noah. Is really, we need to think about leading with equity and leading with race specifically in our response efforts. So we know homelessness prior to COVID, prior to wildfire, the impacts in our state, we know that homelessness across the country is very much a racialized issue. It's very much a racialized issue, a problem that derives itself from the systemic racism that we see across our country, across a variety of different sectors, from criminal justice to healthcare to housing. We know that African Americans are vastly disproportionately overrepresented in the homeless population. They represent about 13% of the general population, and something like 41% or higher, depending on which counts you're looking at, of folks experiencing homelessness. So we have a lot of work to do around how racism affects the experience of homelessness. So any disaster strategies, any policies that we make need to explicitly incorporate race into how we think about the design. So one example from us, as we've really tried to think through what this looks like, we have a wildfire program that provides grants to, previously it provided grants to homeowners. It was $7,000 grants, really meant to be an addition to FEMA's assistance. And we took a look at the policy and realized that we really weren't designing the program with equity in mind. So what I mean by that is it was only for homeowners. And we know that homeowners are really, there's another huge gap in terms of the white-black disparities between who is a homeowner and who has access to home ownership opportunities. So we looked at that policy and changed the dynamic to incorporate renters, because we know that that's a step in the right direction to really think broadly. Additionally, we also realize that if we just sit back and wait for FEMA to be the sort of front door into our program, that we're going to miss a lot of people. There's people that just don't want to interact with FEMA. They don't want to, even if it means they're going to experience homelessness or they're not going to be able to get the resources they need, they're never going to apply for FEMA. FEMA doesn't allow folks who are undocumented and to receive assistance, and that fact alone means that we have an obligation to respond with something and really do intentional outreach for folks who are not able to receive that assistance. So we are looking at hiring a culturally specific organization to do outreach for us on that program, to specifically reach out to communities who are overrepresented and not receiving that assistance from FEMA, and be able to reach them for additional support. That's just one example, but I think the lesson of like really thinking through how every policy, every decision we make at citing shelters, designing our interventions, need to be driven with a focus on racial equity. And if they're not, we're probably more than likely really failing folks who are most impacted by the crisis. Just another thing I wanted to hit on is that disaster really brings with it opportunity at times, opportunity to rethink how we do things. So for us, it's really meant breaking down silos. As you may know, state agencies have a challenge oftentimes in interacting with each other and also interacting with local organizations in a really thoughtful and planful way. So we really had to examine and take a hard look at some of the processes we had set in place that were actually making silos sustain. They were making it really hard to continue to collaborate and work together across different agencies and different response efforts between the state, local, and regional kind of efforts. So we had to start standing up new work groups, new committees, where we were able to connect with the experts on the ground and have the experts on the ground inform the state to make decisions about where to send resources. Those types of silos exist for a reason, and more often than not, they're not helpful. They're not something that we want to see sustained. So one good thing about disasters like this is that we can examine those opportunities and make change. And then lastly, I think throwing out the manual, really, like we've had to really think through how to pivot and change the way we do our work. So for instance, in Oregon, we have historically funded 18 different community action agencies across the state who provide an array of different services to support people experiencing homelessness, people in poverty, and really a whole range of services. And we have relied on them extensively for our COVID response, for rental assistance, and for other important critical response efforts, both in the wildfire as well as preparing for cold weather. We also had to think about how that decision to fund those agencies nearly exclusively had impacts on communities of color and people more overrepresented. So we took a hard look at that policy and were able to get some flexibility from the legislature to really think through our COVID response and our shelter response in particular, to incorporate culturally specific organizations and other community-based organizations who are reflective of the communities that we're trying to reach. So we are currently working on a process to do a competitive application for our ESG CD dollars. That's a HUD program, to make sure that we're really thinking through how to use these additional resources that have come in to strategically reach the communities that are most disproportionately impacted by homelessness and by COVID. Additionally, thinking through like how the impacts and those overrepresentation in the crises we're talking about need to drive our funding decisions. Like, that's how we need to make funding decisions. It's really based on like who's most impacted, and then we reach out to the organizations in the communities that are really representative of those needs. So that has been something we've been really doing a lot of soul searching on, and really trying to examine how our policies are perpetuating some of these inherent disparities and making strides to change them. I think there's a lot of learning lessons here, but I'll leave it at that, and hopefully we can dive more into it in the Q&A.
Thanks, Mike, and thank you, Michael Durham, for putting a question in the Q&A. I'll ask my panelists and attendees to look at that. And Jody, I am going to start sharing your slides. Take it away.
Great, thanks everybody. My name is Jody Rao. I am a community public health nurse. I've been doing this work for 16 years. I've been with the Seattle-King County Public Health Department, specifically with Healthcare for the Homeless Network, for the past 5. I started out as a nurse on our mobile medical van, worked with John for a couple years, so mine and his content kind of weaves together nicely, I think, so hopefully you will find it beneficial. I've also been, since February, leading a huge amount of our efforts around our homeless response for COVID. So Regina, if you want to go ahead and shoot to the next slide. I'm going to keep this as brief as possible without speed talking so we can get to some discussion. But starting way back, we really engaged a lot of those principles that you're hearing from Noah and Mike and John around engaging with our emergency response system, which for us is our Health Medical Area Command, or HMAC, because I love the acronyms. All of this work was really, really deeply embedded within our Healthcare for the Homeless Network, which is a part of our public health in King County. We also really partnered with other divisions and departments within public health. So certainly our prevention department and our communicable disease and epidemiology teams, our environmental health teams, and then our Department of Community and Human Services, which is the housing side of homelessness in King County, and where our behavioral health folks also live. So we started out with really the work that Healthcare for the Homeless in King County has been doing for decades now, engaging our agencies, engaging our sites, our networks, and sort of the extension of folks of where our contracted providers go. And then we pulled in a much tighter interdepartmental, interdivisional community-based response. And so that's kind of this heart at the center. There is a new program that really has come out of Healthcare for the Homeless and now lives in our Community Health Services Division, but it is our Health Engagement Action Resource Team. This is environmental health, this is behavioral health, this is predominantly public health nurses, and they do a ton of sort of prevention and sort of responsive work specifically around COVID and homelessness in our homeless service agencies, really helping that layers of mitigation factors that we know are going to keep people safe and healthier. So kind of John mentioned the masking, the physical distancing, the disinfection and hygiene. We are really leaning in and adding a fourth around ventilation. as part of the work that we're doing, and really pulling in our environmental health colleagues around that. The other piece that I think we've mentioned a lot here, which I appreciate, and I'll try to do a quick drop of what we're doing, is the racial equity work, but also just the behavioral health. People are tired, people are stressed. With this surge in this winter, we're seeing a ton of, I think, traumatic response from the beginning and back in February and March. And that is also at play. And I don't want that to get overlooked, because that makes doing all those mitigation factors, engaging all of our community, engaging folks with experience, a lot harder to keep showing up and doing the work. So Regina, you can go to the next slide there. So since February, March, we really did a lot of the de-intensification. So took our larger congregate shelters and moved the most vulnerable folks into motel rooms. That has maintained, we've been able to maintain that. But as we're looking at winter shelters and emergency shelters that may only pop up for a couple days, or in 2019, we had some that were up for 2 weeks. Staffing of the agencies that normally do this work are really stretched thin because they're already at multiple sites. So that has been one factor that we've really had to pay attention to. Lessons learned from 2019 is that we were able to add like 400 plus beds across the county. And we suspect we're not going to be able to get to that level simply because both staffing is a limited capacity, funding is at limited capacity, but also just because of that de-intensification and wanting to maintain some of that is also super important. We have engaged with our community since the beginning with weekly phone calls, sort of a writ large community-wide homeless service provider, and then very targeted to encampment outreach workers. What we've really done with our HEART team is, and they've been doing this work from the beginning, but they're partnering and collaborating with our homeless service providers and our agencies, and they're going out to specific sites and to different shelters and day centers and adjunct homeless service sites, and they're really looking at how are they implementing those best strategies, those mitigation strategies. They're helping them identify an isolation space, even if it's just for a couple hours or overnight, till we can get someone into an isolation and quarantined bed. They're really talking about how is mask use working? How well is that going? We're doing a ton with environmental health, and now we're really pulling in ventilation experts, air quality experts, certified industrial hygienists, and we're coming and looking at physical spaces through those lenses and how all of those things come together to really build up those layers of protection. Because as we all know, any one of those individually is not going to do the job. What we've really done is we've upped that effort, learning from some of our air quality shelter that we put up, or our smoke shelter, when we had some wildfire smoke just this past summer. And really looking at what was our ability to do testing before. We did end up having a positive case come out of that setting. So how we responded to that and how we were able to mobilize very quickly, keep it open a couple days longer so we could get testing into there. And then doing what is not typical usually, at least not in King County, historically with emergency shelters that are a little bit temporary, responding to weather or disaster, is kind of an exit interview, and trying to do this in a trauma-informed way, but really trying to learn where people are going, knowing that there's going to be potential exposure, and then moving out into the community so we could then follow up more closely and partner with our disease investigators and our contact tracers to really learn where folks in the community may have gone if we learn of a positive after the fact. The other thing, we've worked really closely, again, in collaboration with communicable disease and epidemiology teams, and then environmental health, healthcare for the homeless, and some of our staff physicians within public health, is emergency shelter guidance. And so that's being finalized and we're sending that out. So I'm just going to pause there. That's what we've been doing at a very high level. We also have an equity tool that we've been utilizing so we can understand how we're responding when we have limited capacity in a way that is leading with race for interventions that we may need to make banking card choices for. So thanks.
Thanks so much, Jody. Great comments. I want to just ask my panelists if they have any comments generally on healthcare for the homeless or health sector involvement, specifically in community planning around cold weather and disaster response. If there's any more comments you want to add around that.
I would just say that there's a lot of healthcare for the homeless programs around the country that have been involved in sort of at the planning table around COVID response from the very beginning. And while they, like all of their partners in the community, have been stretched thin, have, in many cases, staffing constraints, et cetera, there have been some really innovative new approaches that have integrated healthcare for the homeless into them. So, for example, in Boston, in Seattle as well, coordinating on testing so that if there could be proactive COVID testing at a shelter, and that this would apply to a new winter shelter as well, at least theoretically, that a tent could be set up, in the parking lot. There could be people that come outside, like a side door of the shelter, and people are tested. Now that we're in flu season, there's some healthcare for the homeless providers and public health agencies, et cetera, looking at how to integrate flu vaccine events with COVID testing or COVID prevention because of this overlap between COVID symptoms and flu symptoms. And the challenge for shelter providers, at somehow trying to triage and determine, does this person have flu or do they have COVID, or, kind of an even worse situation would be if they had both, right? So, and since a lot of the responses to preventing the spread of flu overlap with the responses in preventing the spread of COVID, HCH providers have just been really, and other community health centers providers have been really integral to that planning.
Thanks, John. Just to rush ahead because I want to address a question that came up. Jody, can I ask you to talk about client and consumer engagement in planning?
Yeah, so we are really fortunate in King County. Our Healthcare for the Homeless Network has a community advisory group as part of our board. And we have been able to engage with them quite specifically around a lot of the information that we've been needing to put out to people that are living either outside unsheltered or within shelters and things like that. We are now moving towards, as we're looking at a sustained sort of organizational structure for COVID response and homelessness, we are really elevating a position of community engagement that will directly involve our folks with lived experience as part of really looking at our panel in terms of across our system of how we develop policy, how we're implementing interventions, whether it's testing, whether it's HUD going out and talking to folks, whether it's environmental health or behavioral health needs.
Thank you. We are right at time, so quick final thoughts, comments, very quick from our panelists. Noah, I will go to you first.
Yeah, I'd say very quickly, I spoke with somebody from Houston after Hurricane Harvey, and they told me that the world would be a better place if we all acted like it was the day after a disaster all the time. And I think people have this idea that everybody's selfish after a disaster, but actually I think oftentimes it's the opposite. So I'll leave you with that. Plus, if you have questions about FEMA, public assistance, non-congregate sheltering reimbursement, please hit me up. I can help with that as well.
Thanks, Noah. John?
I would just reiterate, the theme that Jody was talking about in terms of people with lived expertise. As an example, asking people why they don't want to go into shelter and how can we help them during the winter if shelter is just not an option for them.
Thank you. Mike?
Yeah, I think just shelter is a necessary evil in our system, but what people really need is housing, right? And continuing to look at policy solutions where housing isn't a thing that has to be strived for, but that it's something that is a right, that people, we don't say, oh, we ran out of, mortgage interest deductions. Sorry, you're going to have to come back next year or 5 years. We should think the same way about vouchers and access to affordable housing.
Excellent. Jody?
Yeah, I would just say as soon as you can bring different parts of your community response together, including that really, really important piece of folks that are experiencing homelessness, providers, our response has become so much stronger and so much more effective as we've integrated the feedback we've received and then, really found a way for them to sit at the table, not just, get that message to us, but actually be in dialogue around our response. So sooner you can do that, the more you can do that, the better.
Thank you, panelists. Thank you, attendees, for being here. We really just started skimming the surface. The council is going to continue having these conversations and continue learning from our community. I will get all the links and email addresses mentioned here into the follow-up materials that go out when this recording is up. Stay engaged with us. Thank you for coming, and thank you, everybody. We're done. Happy weekend.